This next test is called the FABER test, and what we'll be looking for is hip joint pathology. You want to indicate to the patient how to position themselves on the table by touching the lateral ankle and then touching the top of the thigh and the opposite leg. So go ahead and move in that position. This is the negative test if her leg falls really far to the side and doesn't have any hip joint pain. Hip joint pain would be either a labral tear or osteoarthritis, something like that. A positive test would either be with the leg staying up in this position or actually present with pain at the hip joint. Now, if the leg doesn't seem to fall in sort of a funny position, not all the way down flat or parallel to the table, but some portion of the way, and you want to see if there's hip joint pathology, the next portion of the test is you put your hand on the knee, the opposite ASIS, and I'll put a little bit of overpressure or pressure. Now, again, I'm looking for hip joint pain. If you do this test and you put this pressure on, sometimes the patient will feel SI pain or facet joint pain. But the test is FABER, which is really trying to indicate whether there's hip joint pathology. Okay, that's good.